Okay, so today we're diving into, a really vital area, diagnostic imaging.
And specifically how you can maybe get a better handle on it.
Exactly. We're looking at a particular resource that aims to help with just that.
Okay, what have you got?
It's a book. It's titled 100 Questions and Answers in Radiology, and it's by Dr. Atef Ahmed.
100 questions and answers. So a Q&A format. Sounds pretty direct.
It does. And our mission here really is to explore what this guide offers. It seems to be pitched as, more than just a list of facts.
Something deeper, maybe. About understanding.
That's the idea. It's framed as a pathway to really understand how we use technology to see inside the body, and critically, what those images actually tell us.
So the core concept is that structure. 100 questions expertly chosen, apparently, each with a detailed answer.
Right. And what's interesting, what the source really emphasizes, is that it's not just about learning facts by rote.
Like flashcards, but more involved.
Exactly. It seems to be aiming for what it calls a profound understanding of radiological findings.
Okay, profound understanding. What does that actually mean in this context, do you think?
Well, I reckon it means going beyond just spotting something abnormal on a scan. It's about understanding why it looks that way, what the implications are for the patient.
And how it all fits into the bigger clinical picture.
Precisely.
Yeah.
And maybe that Q&A format is key to that. You're not just passively reading. You're kind of testing yourself, engaging actively, and then getting the explanation.
That makes sense. Active recall and then context. And does it cover a lot of ground?
It seems so. The source says the spectrum is really wide from, the absolute basic principles.
With the physics behind it all. How the machines work.
Yeah, that kind of thing. All the way up to advanced imaging techniques. So quite comprehensive.
And does it mention the specific types of imaging?
It does. It lists the main ones you expect. X-rays, the classic starting point.
To-the-wall X-rays, yeah.
And CT scans using X-rays, but giving those cross-sectional views.
Right. Computed tomography.
MRIs, which use magnets and radio waves, especially good for soft tissues.
Very detailed images there.
Ultrasound, using sound waves often used in real time.
Like for pregnancy or looking at blood flow.
Exactly. And nuclear medicine as well, which involves tracking radioactive tracers inside the body.
So different methods, giving different kinds of information, a good overview.
And this leads to something the source really flags, the focus on clinical relevance.
So not just theory, how it's actually used with patients.
Right. The book is apparently designed around the real-world applications you'd actually see day to day.
Which is essential, isn't it? I mean, knowing the physics is one thing, but applying it when you're looking at Mrs. Jones's scan.
That's the whole point. And the book explicitly aims to enhance your ability to interpret and analyze these images in that clinical context.
Bridging that gap between the textbook and the diagnostic challenge.
Yeah, exactly. And because of that approach at the Q&A, the clinical focus, the source, pitches it as a really strong educational tool.
Makes sense. Good for exam prep, maybe. That Q&A format sounds ideal.
It's definitely mentioned for exam prep. Also for self-assessment, checking your own understanding, and even as a quick reference.
Like if you're on call or in a clinic and need a quick refresher on something specific.
That seems to be the idea. Quick, reliable clarity.
And is it easy to use? Radiology can get pretty dense.
Well, the description says the content is clear, concise, and logically organized.
Okay, that's important. User-friendly.
Vital, I'd say. It suggests that readers at different levels, beginner or more experienced people, can actually use it without getting totally bogged down in complexity.
So who is it actually for? Does the source specify the target audience?
It does, quite clearly. First group, medical students.
Right, giving them a solid but accessible introduction to the whole field.
Exactly. Then, radiology residents, the doctors actually training in this specialty.
For them, it sounds like that quick reference function would be key, a reliable guide when they're learning the ropes.
Seems like it. It's also aimed at other healthcare professionals more broadly.
Like ER docs, surgeons, GPs, people ordering scans all the time.
Yes, exactly those. People who need to keep their knowledge of imaging up to date because it's so central to their work.
Makes sense. They need to know what they're ordering and roughly what the report means.
And finally, it mentions instructors and educators.
So a resource for teaching radiology concepts. The Q&A format could work well in a classroom setting, I suppose.
Could be quite effective, yeah. A structured way to guide learning.
So, quite a wide range of potential users. And what's the overall promise? What's the big goal for the reader?
The source uses some pretty strong language. It says the goal is to help you embark on your path to radiological excellence.
Radiological excellence. Ambitious.
And also to help you in mastering the art and science of radiology.
Ooh, art and science. I like that. It acknowledges both sides.
Right. It implies there's the hard science, the physics, the anatomy,
That technical stuff, yeah.
but also an art, a skill in interpretation, in seeing those subtle patterns, connecting the image findings back to the actual patient.
So true mastery isn't just knowing how the image is made, but really understanding what it means for that individual person.
That seems to be the core message, the technical knowledge plus the interpretive skill.
Okay. And if someone listening is interested, where can they find this book?
This source gives availability info.
Good.
It says 100 Questions and Answers in Radiology is available on Amazon
Standard place.
and also directly from the dratef.net shop.
Okay, good to know. Direct option too.
So let's sort of wrap up this deep dive. We've looked at a resource, this book, that tackles learning radiology using that specific Q&A structure.
Right. Aiming beyond just facts towards a deeper, clinically focused understanding.
Covering the whole range of imaging, from basic x-rays right through to nuclear medicine techniques.
And positioned as a useful tool for lots of different people, and healthcare students, residents, other clinicians, even educators, for learning, for review, for quick reference.
Ultimately, it's about boosting your ability to work effectively with diagnostic images in real practice.
That practical application seems key.
Definitely. Now, thinking about that phrase, mastering the art and science, and this idea of gaining a profound understanding, it makes you wonder, doesn't it?
How so?
Well, with all these incredible ways we have now to see inside the human body, and this real emphasis on understanding the meaning behind those images clinically, what does it truly take for someone in healthcare to go beyond just, seeing a picture?
To actually see the patient's story within that scan.
Exactly. To see the underlying condition, the whole context. What possibilities does reaching that kind of profound understanding really open up? For making diagnoses, yes, but maybe even more importantly, for how we care for patients.